Hi, Rachel. I'm here with Rachel. Rachel's my midwife for my first baby at a birth center, and then most recently my third baby at home. And so I asked her, I did, a chat box on Instagram being like, what questions do you have for a home birth midwife? And so these are questions that people submitted, and we're just gonna chat about it. So first of all, this is not medical advice. Always seek your practitioner. This is just us casual conversating about home birth with a little bit of expert opinions. So got some questions. We're just gonna keep it casual and conversational. So I think we'll just dive right in. So one question we got a lot of what are people want to know what will risk you out of home birth, and what are the most common reasons people are transferred out of home birth care throughout the pregnancy?
Yeah, so I mean, there's a number of reasons you can be transferred out of care, but midwives are, constantly assessing that risk. So even at your consult, when you first contact your midwife, she's going to ask you a bunch of questions, make sure that you're, a good candidate for out of hospital birth, make sure that you're low risk, and then throughout your pregnancy, you're also, risk is constantly being evaluated by your midwife. So at all of your appointments. And if at any time, something comes up, you could be transferred. But a lot of times it's just a consult, with an OB to see if you're still, okay for out of hospital birth. But a handful of things I can think of are like preeclampsia. That's one of them.
High blood pressure?
Yeah, high blood pressure that's starting to, affect your body and your organs and could affect the pregnancy.
Okay.
Gestational diabetes that's not controlled with diet alone.
Oh, got it. Okay.
Risk you out. So some women do develop gestational diabetes that, we can just control and keep the sugars down with just a diet modification. But if it goes beyond that, then that's a transfer for me anyway. So,
Okay. Okay.
some of these conditions, you may find a provider that will still allow you to do out of hospital birth, but these would be, risking out for me.
Like placenta previa.
Yeah, placenta previa. So
I
that's
mean,
the placenta
covering. Yeah.
covering the cervix. Yeah. A lot of women have low-lying placentas early on, but then they usually migrate out, away from the
Oh, got
cervix
it. Yeah.
towards the end. So if that's the case early on, usually it's no problem. They'll migrate and there's just no problem. But if it's persistent and into the, third trimester, then that's a little more of a concern and could risk you out.
Mhm.
Breech presentation would be a risk out for me, but there are providers in the area who will perform breech home birth. And so
Okay.
it's a matter of getting you to the right person.
Yeah.
You're wanting to still do that.
Okay.
Cholestasis is another one that comes
Oh, yeah.
top of my head. And so that's a liver disorder. It increases bile acids in the body, which can be harmful to the pregnancy and the baby. So those are just a few. These are all still pretty rare, like if you don't have risk factors for them. But those are the most common ones, to be transferred out if there's going to be a transfer.
Got it. Okay. That makes sense. Oh, and then was it the placenta accreta too? That's what.
Yeah, you have a little bit of experience. I mean, not real experience.
Yeah. Yeah.
I got a little scare with that, but that definitely would also be a transfer.
Yeah.
But most accretas are not going to be, accreta is extremely rare. But
That's
if
when the placenta embeds deeply into the uterus. It won't detach on its own.
yeah, so deeply embedded into the uterus. So you're going to have, problems postpartum with hemorrhage. Could even have a uterine prolapse, things like that. So that would be a transfer to the hospital during prenatal care. But they're hard to identify. So in your case, there was kind of a false positive ultrasound you had.
Yeah. 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 Okay. So it sounds like there's not a ton of. It's not super common to risk out.
Yeah.
Okay.
Yeah.
Now, and someone asked. That was kind of our pregnancy questions. Now they're all really about the birth. People are like, what if it's too much for me?
I mean, too much.
Like,
I feel like, what does that mean? I mean,
a lot of people don't transfer because they're like, oh, it's too hard. I don't.
so if that's the question, that's always an option, we can transfer at any time if it feels like it's too much. But
Do you see that a lot? Never?
no. Yeah, that's what I was gonna say. Usually if someone is saying something like that, this is just too much, I need to go, usually the baby's right there. And so usually the conversation is
Yeah.
okay, but the head is coming out. I can't take it away anywhere. Probably deliver in the car if we did transfer right now. So that's usually when that comes up. And yeah, I don't hear it too much in home birth because I feel like my clients and clients who want to do home births in general are very well prepared. So
Yeah.
They know they're not gonna have that epidural right around the corner. They know they're not gonna have those meds that can go right through the IV and get you immediate relief, and so it kind of, they've taken childbirth education
Right. You were prepared.
yeah, they've got an amazing birth team, they've got a doula usually, and they're just preparation is the biggest thing with that, I feel like.
I wonder, okay, if the person asking this has had maybe like a previous hospital birth, which I have never had a hospital birth. From what I can tell, like it seems like it's like the bright lights and the setting and the pitocin, like you think it's a lot harder
Yeah,
there than at home. So I feel like if you've had the hospital experience and you think it's going to be as hard, it's probably going to be easier than you think it is. I mean, it won't be easy, but
100%. Even just the ability to just get up and move however you want to, like, it's so much harder not to be able to freely move. And they will let you walk around a little bit in labor in the hospital, but you're not as free as you are at home, which
oh
is
yeah.
important. It's like with you, I mean, you know,
All over the place. Always on my knees, but I'm like, I want to be on my knees over
very
at the chair. I want to be on my knees over by the couch. Like,
anywhere. I want to go to the bathroom and hide out for, hang out by myself for a minute. Just
yeah.
this the freedom to be able to do those things is huge. So yeah, I kind of want to know, like, why does she feel that way, right? Like,
Yeah.
does she
Yeah.
have a
Yeah.
previous experience, or is she like, did someone tell her, some
Maybe like,
story?
yeah, movies, media, how they portray it. Okay, so pushing, this is funny. Do you actually have to push like in the movies? What is pushing actually like? And often this is very subjective and there's lots of varying.
Right. Yeah. Well, when I thought about this one, I kind of was like, oh, yes, like, since it's so recent for you, like, it's so subjective, right? Everybody reports it differently. Some people say, oh, I felt like I needed to poop. Some people are like, I felt like ring of fire. Some people felt like, oh, it was the easiest part for me. But everybody's just like different. And then I would say,
Mhm.
don't watch movies and
Come on,
I would say,
don't do that.
watch real
No.
birth videos.
Well, and all three of mine. So you were at the first one. He was posterior, and I feel like I had to really push him out. But then the
Right?
second one, yeah, and then the second one, it was like as soon as my water broke, it was like but I had no ring of fire in the first one. The second one, horrible ring of fire. And then the third one, I didn't push like at all. I just like let it happen. Head came out and then his body just like shot out like a hot dog or something. It just like squiggled out. Like, I don't know. So I
Yeah,
feel
so
like
they can be different each birth you have individually
yeah.
too. So it's just it's very subjective. But for the most part, I hear a lot of people saying, it feels like you need to poo. It's like ring of fire. For the most part, it's just like let your body do what it's going to do and breathe through them. But sometimes, like in your case, if there's a positional issue, we do have to actively push. And so in
Yeah.
those cases, it might seem like kind of like in the movies because we're actually like, okay,
Yeah.
another one, let's push with it.
Yeah. Yeah.
Or directed, but
That's not that common here.
yeah, for the most part, it's just, "Hey, let this baby come on down and breathe it out."
Yeah. It'll just come out.
Yeah,
I
whether you're afraid of it or not, it's coming.
It's coming. I know. So another pushing question is they're afraid that the pain will be too much and affect the ability to push. And I don't feel like I've had that experience of, or maybe it's like, oh, it's almost like maybe you got too tired. Like if you were in labor for like 2 days and then maybe you get tired, but I don't feel like the pain inhibited an ability.
No,
But I didn't even
yeah,
push. I don't know.
I don't see that either. I do see fear kind of sometimes creeping up and, someone kind of tensing up versus relaxing, and it's also almost like they're fighting that. I do see some women afraid to poop, and you can tell because you can see it in their body, and they're
Oh,
clenching their
they don't want to
bottom
poop.
instead of yeah, and so then you just have
Yeah.
to kind of remind them like, "Hey, it's okay, whatever, comes out, whatever happens, you need to surrender to that, and let's let this baby, come on through." But a lot of times that's just a quick conversation like, "Hey, I see you tensing up, stay relaxed," and
Yeah. The reminders.
but
Yeah.
yeah, I don't see like fear inhibiting the birth of the baby. A lot of times, it is what it is, and you're kind of along for the ride at that point.
Yeah, you have to just like you're on the roller coaster. You just gotta go with it. The more you fight it, the worse it's gonna be.
Exactly. Yeah.
Okay, so someone asked like a weak pelvic floor. Like, how does a weak pelvic floor inhibit birth?
Weak pelvic floor.
You hear that a lot?
And I feel like it now, I mean, usually with multips, right? So a
Mhm.
woman who's had several babies maybe didn't see like a pelvic floor specialist in between or build up her pelvic floor in between pregnancies. Sometimes close pregnancies can cause like a weak pelvic
Oh,
floor.
yeah.
In those cases, I don't really see it inhibit birth, I guess, or cause more pain. But I do see like if I had a client who had a very weak pelvic floor, I would avoid certain positions in birth. So I would like
Oh,
probably not have her squatting because she is at more of an increased risk for like a prolapse, you know,
prolapse of the
of
pelvic
the
floor
uterus or the pelvic floor.
uterus.
Yeah.
Oh, okay.
Avoiding guided pushing. So letting her just kind of breathe the baby out versus like the active pushing we were talking about earlier.
Got it. So it's
That's
not really complications that would really happen during the birth, but more like postpartum things could
the
happen.
postpartum or like during the pushing phase, I feel like.
Hmm.
During the pushing phase, but not really problems, just kind of, like I said, we would avoid certain positions. So in her case, I would say it's very important for her to see pelvic floor specialists during the whole
Yeah.
pregnancy. And they can give some really good recommendations on positions that are good for specifically for her for
Yeah.
labor.
Yeah. Okay.
Did you say pelvic before and after?
Yeah. Yeah.
Yeah.
Yes. Yeah. Before and after, or after Rory, and then with Blair and after Blair, and then during this most recent one and after.
Okay. Yeah.
I could tell it
Right.
doesn't they're like, "Oh, yeah, it's good," like, it's where it needs to be, but also I can tell it doesn't feel the same like it did when I was 20.
Right.
After
Exactly. At
wait,
that kind of time. And that's also
well,
like
yeah.
you still have like postpartum hormones
I was gonna
rushing.
say, like, I'm not even 5 months postpartum, so maybe it's still
Yeah.
not,
Still all of
doing its
that,
thing.
but it's good you're working on it. Like, it's so important. A lot of people forget about that part, the postpartum period and how important it is to work on those things, especially if you're in the baby having mode, right? It's like if you're gonna, "Oh, I'm still gonna have, like, a couple more." It's like it's so
Yeah.
important to keep working on those things.
Okay, so,
Um,
you mentioned uterus prolapse. Could that happen, like, during birth? During or no?
well, I've seen it happen in the hospital
Is
once,
that dangerous?
but it was when the baby was coming out, so it
Okay,
was
okay.
blood pressure, and then, of course, the doctor was actively pushing. It was like, and everybody's counting, 1, 2, pushing
Oh, I see.
very actively, aggressively, and so you just started to see the cervix and the uterus starting to kinda come out same time as the baby was,
Oh,
and then the baby came right out, and the uterus was following it. So you could see the uterus and doctor just, put it back in and managed it really well. But yeah, you do have a
I
higher risk of that if you have a weak pelvic floor, but it's very, very rare, even with a weak pelvic floor.
yeah.
Very rare.
Okay, somebody said, what is this? I know what this is, I think. Bicornuate uterus?
Bicornate. Yeah.
Cornate.
So
Like the little heart shape?
what did she ask about it? She asked,
Oh, yeah. Are contractions very painful due to the septum? Okay, so that means the uterus is like shaped like a heart.
Mhm.
And so,
Uterus usually is shaped like a upside down pear, your tummy.
mm,
And then when it's bicornate, it means two horns, right? It's kind of shaped like a heart. So
okay.
two sides there. It doesn't really affect birth much, but it can affect like the position of the baby. So you see it a lot more breech
Oh, right. Right.
station with bicornate uteruses or uteri. Sometimes people have a harder time getting pregnant with the bicornate
Hmm.
uterus. I have seen some, like, abnormal labor patterns in labor, so, like, what's called coupling is when you have a strong contraction and then you just have, like, a little weak one after, but they're
Oh,
right back and then, like, a long pause, and then the same thing, so it's coupling, versus, like, big one, and then big one, and then big it's these little kinda abnormal
interesting.
contractions, so it can affect labor that way, whereas, it may take longer because you have that weird little pattern, but
Okay.
I've not seen it be more painful, nor have I seen any, like, evidence of
Got it. Okay. This one's a good one. So, how to prevent throwing up? I hate throwing up. That was like,
I feel like you did. Oh, did you early on?
I never threw up once in pregnancy or birth.
Yeah.
But it's something that I spent a lot of time processing and preparing for in the first, being like, what if I throw up in birth? And I did not, but I understand the fear.
Oh, I know. It's pretty common. Most times it's handled just with like peppermint oil, essential oils, cool wash rag to like the back of the neck or the forehead. That's for like the occasional nausea and vomiting. And then, staying hydrated is super important. So frequent sips of water and snacks. But if it becomes a problem like excessive, then I mean, I know personally I will recommend starting an IV and give medications through the IV if needed. And that's mostly because being hydrated in labor is just so important. Like it's so much harder when you're dehydrated and exhausted and it affect your pattern.
That makes sense 'cause I even remember, like, I texted you, I think at, like, 20 something weeks being like, "I'm having really bad, like, cramps right now," and I was, like, worried, and I was just really dehydrated.
Yeah, sometimes it's actually a good reminder that you are dehydrated. It's like you can, get so busy in life and forget, and that's definitely something in pregnancy that can remind you. It's like, "Oh, I think I'm contracting and
Yeah. Like,
probably need to
chronic
take this
fatigue.
for." Mhm.
Yeah. Okay, so someone said how to properly breathe and cope with pain. I mean, there's, like, a lot of birth courses on that.
Yeah. So, yeah, take a class for sure. I feel like everybody did you take hypno originally with Rory?
Feel babies with Shaz.
Oh, shit, okay. Yeah.
I'm like, "Is she still around?" I don't know.
No. Yeah, but hypno babies is a great one to to learn how to breathe. And then it's also important to have a good birth team, right? That's gonna remind you to use those tools, and
Yeah.
your partner, right? Your husband, having that person there to help you remember how to use those tools also. Having a doula is a good way
Yeah.
to remember how to do those things. Yeah, but I think preparation is the biggest thing in practicing those things that you've learned.
Practicing ahead of time. Yeah.
Yeah.
I took the online course, Pain-Free Birth, this time, and I really liked that one. She had a
Okay.
good, like, breathing stuff and, like, catching the contraction, like, on the Wits Way app before it, like,
Yeah.
doing it, and I so that one was my favorite that I took.
Yeah, there's so many good ones just online now.
Yes, yeah, and it's just, like,
Yeah.
self-paced, so I just watched it, and being not a first time, there was sections that I skipped. I'm like, "I don't need to watch that part," but they had,
Yeah.
like, written support and yeah,
Yeah.
super good.
But I would say, like, with your first one, I feel like an in-person class is better.
Yeah,
Don't you think? I feel like you really need to, like, to get the whole, and it's also good for networking, right? Like, so
yeah,
meeting other families who are going through the same thing and who have been there and done it already, and
totally. That was
in-person
nice. That was nice in that course when we meet people,
Yeah.
like okay, how do you deal with common birth complications? So I guess what are common complications you see?
Yeah, the common ones, I feel like there's, like, a handful of them, like shoulder dystocia, postpartum hemorrhage, nuchal cord, so cord around the neck,
Okay.
short cord, baby needing a little bit of extra stimulation after birth to
Okay.
stimulate to take those first breaths. I feel like the best way to handle those is, number 1, like, anticipating them, so
Yeah, let's start with okay, let's say we have a nuchal cord. What do you do for that?
most nuchal cords, I know it's a lot of people are afraid of a nuchal cord, but I'm actually, like, surprised when a baby's not tangled up in the cord somehow. If you think about how they're spending time in your uterus, all those movements, they're getting tangled somehow. But sometimes it's can be pretty tight around the neck, and in those cases, there's some maneuvers that your provider can do. A lot of times they just deliver through that cord. If you keep the head kinda close to mom's upper thigh, usually they can
Mm,
force the baby out that way. But if it's super, super tight, and I've only had to do this once, but you can clamp and cut the cord on the
oh,
period, as the head is out. But usually babies can just deliver through even tight cords.
okay.
Yeah.
All right, and then you said, shoulder
Shoulder
dystocia.
dystocia. Yeah, so shoulder dystocia can come up out of nowhere. Again, anticipating if like she's had a really long second stage of labor, so she's pushing for a really long time, that tells me that, is this baby big maybe? And, that's why it's taking so long. And, if I'm thinking that, then I'm usually communicating with my birth assistant, like, "Hey, watch out for shoulders when this baby comes out." But there's several maneuvers the midwife can do to dislodge that shoulder. So one of them is just maneuvering the mom, right? So getting the legs super far back and having her push that way, turning her on hands and knees. And there's also some other manual maneuvers that the midwife can do to rotate that
I
posterior.
see. I see. Okay. And then what about what was it? Oh, baby needing like not breathing or
Yeah, so we're all certified in neonatal resuscitation. So if a baby needs extra help, usually it's just like the baby just needs a minute, right? So if you just give the baby a minute to realize, anatomically that it's out of the uterus, it just takes a minute for that baby to take those first breaths and let those reactions happen within the baby to take those breaths. But sometimes it's just a gentle rub on the back or tickle on the foot to jumpstart that baby. And if it needs more than that, then we can give oxygen with the bag.
have you ever had to call 911 on
Yeah.
baby?
Yeah, definitely have had to do that before, but they come usually come pretty quick. And usually a lot of times it's like if I've had to do that, by the time they get there, the baby's stable and
Yeah.
it was just good to have them there in
Just
case we needed to go. Yeah.
yeah. So speaking of someone said stuck babies, like asynclitic. Like, do you maneuver the babies? Is that different than shoulders dystocia, asynclitic?
Yeah, asynclitic is more like a problem with the internal rotation. So babies usually are coming out like chin to
Yeah.
chest, kind of
Yeah.
tucked in. And asynclitic is kind of like they're coming in a little
Right.
tilted to the side there. And
Yep.
so when they do that, that surface area of the head that's trying to come out is way bigger than it would be just the back there. And so the best way to fix that is to move the mom. I feel like a lot of positional issues are best.
Got it. So
to
that's
move-
not like an automatic transfer for you.
No, but a lot of transfers are because of like a bad position of the baby. So asynclitic, if it's deeply engaged into the pelvis, we can try some maneuvers for mom, but sometimes that doesn't fix it. And if, you're unable to move that baby manually, like sometimes your midwife can manually turn that head with her hands or fingers.
Yeah.
The client can tolerate that. That can sometimes work. But if that doesn't work, then it sometimes is
It's great. Is that like a 911 call or like we're driving to the car?
yeah, that's like we're going to the hospital, private vehicles,
Got it.
labor and delivery, getting you checked in, probably an epidural, maybe even vacuum assisted birth, things like that. Yeah.
Okay. Now, postpartum hemorrhage. This is something that I've always feared. It never happened to me. But so it's that.
Yeah. When I read that, I was like, I want to know why that's your biggest fear. So
Yeah,
I feel
it
like
feels like I don't know.
you've never had one, and that's one of your biggest fears.
Yeah. Like, although, I mean, I know, I think someone told me, it was like, if you were having like a true hemorrhage that couldn't be stopped, you could just apply pressure to the like uterus and stop the bleeding and then you're the ambulance. Like, you're not going to die.
No. And most of them are just handled with just massaging your uterus or putting the baby on the breast. But if they, you're starting to lose a lot more blood, then, sometimes medications are necessary. And so in that case, your midwife, has all those medications. She carries all of them and can give them to you if needed.
Yeah.
You held up the scary one, but like what's that?
You don't see like major hemorrhaging.
No, I've never had to transfer because of it.
Oh.
But I have seen them in the hospital, major ones where they've had to go to the OR or to intensive care. But I do feel like that is intervention caused, the ones that I have seen that are very severe. And that's because a lot of times in the hospital, your uterus is overworked by all these medications, or they mismanage the third stage of labor, which is the delivery of the placenta. Like they're yanking on the cord and, just trying to get it out. So you can prevent most of them by not doing those things.
Right. Yeah. Your uterus is so tired for the Pitocin that it can't.
Yeah, it can't compact there. Yeah.
Yeah. That makes so much sense. And then they're like, we saved you. But you're like, yay, I'm here. Yeah. Okay. My Zoom is like almost running out of time. I don't have a paid power. I hope it doesn't cut us off. But okay, the last question is just the VBACs. Like, what is the risk of rupturing?
Yeah, VBACs.
Yeah.
So,
I guess is it possible to have a VBAC at home with the placenta 1/5 centimeter from the cervix? I think it's just VBACs and the fear of rupturing is kind of like the big thing.
yeah. So it's definitely possible to have a VBAC at home. I would say first, so the incidence of rupture is about 0.4 to 0.9%.
Okay.
But that number can be elevated depending on like history or
I see.
if she's being induced or, there's a number of things, number of variables that can change that number. But typically it is safe to deliver out of hospital with a VBAC. I would say it's important to have a good support system. Everyone who's at your birth should be, supportive of your decision. I would say you should speak to your provider and figure out your individual risk of rupture because, it's going to be different depending on your history,
Yeah.
like that. And then, I would say surround yourself, educate yourself. ACOG has some good information on VBACs, and so does evidence-based birth.
Oh, yeah.
Yeah, I think the support system is probably one of your biggest thing, finding the provider who's
Word it. And
and
there's an Instagram account called the VBAC link that
yeah,
you
VBAC.
got.
VBAC facts is good. There's a
Yeah.
good fact sheet there.
So do you do a lot of VBACs is it like a midwives like, oh, I specialize in VBACs, so I'm like VBACs go to them, or like is it not like that?
No, I mean, I love VBACs because I had a VBAC. My son was breached. I had him C-section, then I had my daughter VBAC. So they are close to my heart. I probably do like 1 or 2 a year,
Okay.
but I have a small practice. So,
And yeah, and generally they're all good.
and usually they're because some, a baby was breached the first time or just wasn't given enough time. Maybe someone went through that whole, okay, let's get you induced. The induction fails. And, someone decides, hey, you've been in labor too long, you need a C-section. So
Got
those are like the best candidates that I see and usually
Yeah.
end up brings just fine.
And like redemption.
Yeah, it feels so good. Yeah, for everybody.
Okay. Well, that was all the questions. We could find you on Instagram, right? Birth.
Yeah, on Instagram.
You're active on Instagram.
Not much.
Okay.
But I am on there. I do have my own site too, like just a
Yeah.
land.
Well, yeah. We'll put your website and your Instagram for people to find you, especially if you're local to Orange County. I say if you're not local, then it's not going to be the right fit for you.
Yeah. Yeah. I mean, I do some Riverside and some.
Yeah.
It has to be like within a certain.
Yeah.
point.
Or I guess, I mean, if you're in Arizona, like this is not going to be, you're not going to be the right.
Not for you.
But yeah, oh my God, it was so fun. Well, I'll have to do like another round of like a question and do like a part 2.
Cool.
Yeah. Thanks for coming. We'll put out all your website, Instagram, and yeah.
Perfect. All right.